The role of next-generation sequencing is really a tough one to predict or to really categorize. What I would say, though, is we've gotten to the point where there may now be enough biomarkers that are relevant in colorectal cancer that we need to think about doing next-gen sequencing, these broad platforms, rather than selective mutations. Next-gen sequencing has the appeal of finding potentially actionable mutations that you wouldn't expect to find. But in colorectal cancer, it's been basically a dead-end street. We've found nothing beyond RAS or MSI high, which of course does not require next-gen sequencing, and BRAF. Those can all be done with immunohistochemistry or straightforward tests. The reason I think next-gen sequencing may now force our hand is the presence of these unusual mutations, let's say the NTRK fusion. For example, it may be 1 in 100, but that may identify the rare patient who could benefit from a different therapy. When you start getting these mutations that are agnostic to the disease, you almost have no choice but to go on a search for that, because you don't want to leave something on the table for a patient that might help them. So I think we're getting to the point where we'll have to do that. And it's not practical to keep adding one more gene question to a panel. At some point you need to go with next-gen sequencing. So I think we're almost there. It's something we're not happy about insofar as the cost to the system will be immense, but I think we're heading in that direction.